Welcome back, ladies and gentlemen. Ed Carmona has a couple of more points to make. So, Ed.
Okay, I just wanted to mention, for DEERS enrollment, you can enroll your newborn into DEERS using the International Birth Certificate. You don't have to wait to get the CRIBA, which is going to take 6 to 8 weeks. So as soon as you get the International Birth Certificate, which the Red Cross talked about, go over to the ID card office at Building 393, and they can enroll your baby in DEERS. So they have no problems when they go see the doctor. And that's all I wanted to say. Any questions on that? No? Okay, thank you.
Okay. Next, we have Colonel Barr, the hospital commander.
All right. Good afternoon. How's everybody doing? Cool. All right. First of all, I'd just like to recognize and thank Chris Brown and 2nd and 503rd for putting this on. This is a great opportunity for us all to kind of get together and talk and answer questions. So kudos to the FRG, and appreciate y'all putting this on. What I was going to do is I was just going to kind of start out first, just give you a little bit of background in case you weren't part of the original briefings that happened a couple of months ago, kind of talk about how we got here, and then I'll talk through some of the way ahead. And then if you have questions, we'll go ahead and let you ask those as we go along. And then I think we've got a panel discussion to follow. So the big question is, why are we talking about going down to San Bortolo or up to Aviano when we've got this beautiful building sitting on Ederle with a birthing center in it? So a number of years ago, there were significant concerns in the community that the delivery services that were available on the economy might not be quite up to American standard. And about that same time, plans for a birthing center came about with the staffing requirements and the new building and that kind of thing. Along with that, the network providers that we had took notice to that and started identifying some of the areas that we felt they might be falling short in and really started fixing those. So about the same time that the birthing center was built up and running, a lot of those issues had been mitigated in the community. And some of those issues were English language being spoken by providers, the opportunity to have an epidural anesthesia for moms that are laboring, and those kinds of things. There were questions about the standard of care. So they've addressed all of those things, and we've got some mitigation plans that I'll talk through here in a minute. First of all, as the hospital commander here, I have absolutely no concerns about the standard of care provided downtown at San Bortolo or at our two university hospitals, Verona to the west and Padova to the east. Verona and Padova are both university medical centers and have extensive amounts of medical care and specialties available to us. And then San Bortolo downtown is about a 900-bed community hospital, so it'd be like a very large hospital in a large American city. And we've been taking care of our specialty medical care, our surgical care, and our complicated obstetrical care there for years, and have had really no issues with any of that. So I can guarantee you that the standard of care that you're going to receive downtown is very, very good. The other things kind of focus on experience of care. And so epidural anesthesia, obviously very important to most women who do not want to feel the labor pains of going through labor. And over the last 3 years, every American patient that's come to San Bortolo has been offered that anesthesia. So that is available for you. All you have to do is ask for that when you get there, and they'll evaluate you and get that for you. English language, if you've been around the Veneto for very long, it is not quite like it is in Germany. There are some limitations to the amount of English that are spoken in this part of Italy. And so since we can't create English-speaking Italian providers, what we've done a number of years ago was hired substantial patient liaison staff to assist us for our patients that are in the hospital. So we have 9 patient liaisons downtown. We have 2 of them on at any point in time. And then Dr. Novak is a pediatrician at the health center, and he spends every morning, Monday through Friday, rounding on our patients down at San Bortolo. So there is plenty of assistance down there from an American perspective, whether it is for your birth or your postnatal period, or if you just happen to be in the hospital or the emergency room down at San Bortolo, please advocate for yourself and ask for that patient liaison to come and to help take care of you if there's any concerns about that. The other nice thing about having Dr. Novak coming round on you in the morning is the Italian physicians will also round on you in the morning, but there may be some stuff lost in translation. And so if you don't understand what's going on with your medical care in the hospital, please take notes, and then when Dr. Novak comes around, if you didn't quite understand something, you can address it with him, and then he'll be able to address that with the Italian providers to make sure that everybody's on the same sheet of music. If you've been watching the news here the last year or two, we have some significant fiscal challenges in our country right now, coming off of over 10 years of war and having to, our senior leaders having to decide what the Army and the military in general is going to look like. The money does not flow as freely as it used to, certainly, and so we really have to take a very hard look throughout the Army as to what the priorities are going to be going into the next decade and into 2020. The Army Medical Department is also looking at those issues, and as we start to downsize the Army Medical Department will likely downsize a bit to match the FORSCOM force. With that, they have to look very, very hard at each of their MTFs, each of their facilities, to decide, are the resources that are being utilized in one area, could they be better utilized somewhere else? And as we looked at the Vicenza Health Center and the Birthing Center and same-day surgery services that are there, our leadership in the AMED decided that those resources could be utilized better elsewhere in the AMED. That can only occur if we are very, very sure that the network services that we have for our network providers are good. And again, I can assure you they are, and I think our senior leadership is very comfortable with that as well. So we will become, over the next year, another clinic that looks very similar to what we have in Belgium or what we have in Germany. My daughter, for instance, was actually born in a German hospital 13 years ago in Ansbach, Germany, and we had a very good experience with that. And I know some of our panel members will speak to their experiences here in a little bit. But usually what it is just kind of a fear of the unknown until you kind of get there and get exposed to it, and you're in a foreign land and you don't really know exactly what's going on there. I think that's a lot of the concern I think that our patients have. So what I'll talk about here is just kind of the way forward, and we'll talk about how we've mitigated some of that. So first of all, a forum like this is very, very good, where we can get together, kind of explain things and answer some questions, and hopefully this is beneficial for you. The last time I briefed, I think we had talked about our prenatal care network that we were validating. Since that point in time, we have 2 providers that speak English very, very well. That we have one at Casa de Cura Eritrea, and another that's right out the Chapel Gate at Caserma Ederle. And we are still working with San Bortolo for them to stand up their prenatal care clinic over at San Bortolo, and I was able to tour that this past week. They have clinic space set aside. They are remissioning and ordering the equipment that they need. They already have providers on board, so they're just waiting to get all of this put into place. They've got about a month to do that, and I'm very certain that they will get there and get that done. So we should have plenty of options for prenatal care outside of the health center, because we won't be providing that service anymore. And again, our intent here was not just to stand up a network of Italian providers, but to stand up a network of English-speaking Italian providers with the support staff that they need to make your prenatal care go much more smoothly. Of course, we are always available at the health center to deal with any issues that might come up, and again, just ask you to advocate for yourself and let us know if during that process you're having any issues. We will begin transitioning our prenatal care service around the 15th of May. It's been put out before. Our last admission for delivery at the health center will be on the 11th of June at noon. So if you go into labor after the 11th of June at noon, please do not come to the health center, because the birthing center will be closed at that time. But before that time, obviously, if you go into labor and need to be checked, we're happy to take care of you there. So there's a bit of slack in that time frame, as you can see. And what we want to do as we get closer to May, are some of the more complicated cases we have, we'll probably start transitioning out to downtown or to Aviano around the 1st of May. But most folks around the 15th of May. And again, you don't have to worry about when exactly that's going to happen or how that's going to happen. We're going to have all that taken care of for you. I just encourage you, as you continue having your prenatal care visits with your provider, just to start kind of discussing these things with them. And our referral management team is going to be at the ready to get you where you need to complete your prenatal care. How many moms are interested in going to Aviano? Is that decent number, small number? Okay, very good. We've been in coordination with Aviano and with Launchstool, so we've got their criteria for stork nesting, which we've talked about before. So again, as we get a little bit closer into May, we're going to start doing that transition as well. The stork nesting is really the same both in Aviano and in Launchstool. And when we say stork nesting, what that means is that our pregnant moms, usually about the 37th week, actually have to travel to that location and then stay there and complete their prenatal care at that location, and then when they go into labor, they just present to the local facility there and have their baby there. As I've briefed before, the great thing about Aviano is it's only 2 hours away, so it's very close, very convenient, I think, to Vicenza, but they have about the same capacity and capabilities as we do here in Vicenza. So if something happens to go wrong during the delivery and they can't take care of it with a C-section, or if they're starting to see a pregnancy go in a way that they're uncomfortable with taking care of, you might be transferred out to care in Pordenone, which is the Italian facility that's very close to Aviano. That's a rare occurrence, but that is a slight risk to stork nesting there. Stork nesting up at Landstuhl is a full-service medicine. They can handle any kind of delivery that happens, so there's really no risk of you being transferred out to a German facility. However, Landstuhl's 10 hours away, depending on how you drive, so it's a little more inconvenient, especially for fathers. One of my main concerns with the stork nesting issue is just really what your social situation is at home, and so obviously a first-time mom with no kids at home and dad may be in the field or not, probably not as big an issue to live in a hotel room for 3 weeks and then deliver a baby at Aviano. Obviously, if you have 2 other children at home or you've got kids in school, that might put a bit of a crimp in your plans there. But I would just ask you to talk through that as a family, and if there's anything that we can do to support you either in your decision or your transfer up there, to let us know about that. Very comfortable with services both at Aviano and at Landstuhl as well, and Colonel Lawrence is very interested in hosting as many Vicenza patients at Aviano as she can. So we're here to support her and to support you, and obviously whatever works out best for your family, we're here to support you on that. I had a question a little bit earlier about how that gets paid for. So for the mother, the expectant mother, the medical community will pay for your travel, your lodging, and your meals while you're at either location. For the fathers, since that doesn't come out of the medical budget, that's on the unit to determine, and usually units, if they can spare you, for a couple of weeks, the commanders are probably just going to have you take leave to be with mom, and that's probably the best situation because all the other things will already be paid for. But I would ask you to engage your chains of command. Most of the chains, or all the chains of command I've talked to have been very, very supportive of this entire process, but that'll be a conversation you just need to have with your chain of command as we get closer to those dates. Speaking a little bit further about San Bortolo, San Bortolo does have a neonatal intensive care unit, a NICU. That's a 4-bed NICU, and they can really take care of almost anything that a baby can throw at them. So if we have a baby that takes a turn for the worst, they usually have the capability to manage that very appropriately. If things get out of their scope of service, then they transfer to Padova, typically, or to Verona, and we've had very few instances of that, but excellent outcomes anytime we've had to transfer someone to Padova or to Verona, so those are good services available. There was a lot of talk as we were starting to brief our expectant moms when we found out about the decision. We had the big community town hall. We tried to call most of our moms, got a hold of about 80% of them, but we took back a lot of great issues. And so a lot of the things that you might be concerned about, hey, there's no Wi-Fi at San Bortolo, what do I pack, where do I get my circumcision done, all of that kind of stuff. We've captured a lot of that and are working those issues with San Bortolo. And again, Dr. Angonese, who is the Director General down at the hospital, has said whatever we need to provide care to our expectations, he's very willing to engage that. And that will be an ongoing process. So I briefed Major General Line a couple days ago. My staff did, and I was in on that briefing. Just kind of let him know how things are going. And as I am, he is just as concerned that we stay in touch with our patients as we start this transition onto the network. So after we have full transition down to San Bortolo, you should expect myself or somebody on my senior staff to come and see you while you're in the hospital. And what I really need for all of you to do, whether you're here or whether you're stork nesting at a military facility, is really take those good notes on what worked well, what didn't work well, what was not there that you wanted, what were you surprised by that worked well, and just kind of do that little after-action report for me, and then we can take those things back and ensure that we're making that the best product downtown that we can for each subsequent patient that we have down there. A lot of the work that we've already done, I think, is hopefully going to prevent a lot of those lists from being too long. So we're really trying to get after as much of this as we can before you all go down there, so that the stay there meets your expectations. The other things that we've already set up, and we've already had two of, we've had some tours down at San Bortolo. We encourage fathers to attend with the mothers and appreciate the chains of command support for that. I don't think we've had any issues with that yet. The first tour, I think we had 8 or 10 folks down there, and this last tour we had 6. Joe Penhaligan, who's our patient representative at the hospital, has the list based on when you're going to deliver, and she is actually making calls to get you scheduled to go down to San Bortolo. So I would highly recommend, whether you're going to think you're going to go to Aviano or not, to go ahead and go on that tour down at San Bortolo. It's really kind of eye-opening. It answers a lot of questions for you. And if the case should come up where you have to go to San Bortolo, and even though you had other plans, you'll at least be familiar with what you're going to be walking into. That's been a tour that's supported by Dr. Zani, who's the chief of OB-GYN down there, their chief nurse on the maternity ward, and then Joe Penhaligan and Dr. Novak have been on that. So we've got a lot of staff down there to help answer questions as they come up, and we're obviously taking notes as you're asking questions as well. I did have a question about circumcision earlier. The Italians, that is a very American phenomenon. So as you go around the world, there are not a lot of other cultures out there that actually perform circumcision. Nothing wrong with circumcision, but the Italians don't do that in the hospital here. We do perform those over at the health center and the pediatric clinic. So if you deliver down at San Bortolo on your 1-week visit, when you come back for the weight check and all of that, that's when we'll perform that procedure for your son if you have a son. And we'll have a little bit tighter process in identifying that probably as you're leaving the hospital, asking if you desire that, and then we can get that scheduled for you at the clinic. So we'll have a date for you to come in and get that taken care of. All right, I've been speaking quite a bit here. Let me go ahead and just open it up for questions that you might have specifically for me or the process or San Bortolo or where else you might be delivering, and then I think we'll turn it over to a panel discussion.
The hotel and things would be paid for. Is that something that would come out of like our personal account and then we would be reimbursed for that? Or is there like a process for like to get that approved for payment before?
That's a great question. All of us in the Army have a government travel card, but probably not many spouses do. So I will look into that and get an answer back out publicly. My knee jerk right now would be you'd probably put a credit card down and then get reimbursed, but I'll ask that question. It's a good question.
Awesome, thank you.
Thank you. And I'm not surfing the internet, I'm taking notes on my iPhone.
Hi. I noticed that you did say that there were 2 liaisons on at any given time. I've actually transitioned down to San Bartolo for a high-risk pregnancy, and I'd wanted to know what's you guys' standard on leaving OB patients like by themselves to be seen for their high-risk pregnancies. Because when I went, I had no one there, and we tried to work me and the provider.
Okay, are you talking about in a clinical environment?
Yes,
Like
in a clinical environment.
Going to your
I was
prenatal
at a
appointment?
prenatal high-risk OB pregnancy visit. And
Yeah. It's a very complicated process here. Many of the physicians that are on our network don't speak a lot of English, and so what we end up doing is we're actually discussing this further with our TRICARE contractor, ISOS, to figure out how we can better address this. So I probably misspoke a little bit earlier. Usually we'll have 2 liaisons on during the day and then maybe 1 at night. In the afternoon is when the Italian providers ask us to schedule the majority of our appointments, because that way we can schedule them in kind of 30-minute blocks and then alternate our patient liaisons amongst appointments. So in the rare instance that we would have more appointments scheduled than we have patient liaisons to attend, there may be a bit of a language barrier inside that office. So what I'll do is I'll take that back and look at how we're prioritizing those visits. Okay. Many of you may be tracking the Space A issue that's kind of come up here in the last few weeks, and what I'm really trying to do in our community is ensure that I am providing priority of care to our TRICARE beneficiaries, which everyone sitting in here next to a green suitor is, and then providing the maximal amount of care to our community that I can after that. But I've got to make sure that our TRICARE beneficiaries are taken care of. So I appreciate you bringing that up. I'll take that back and find out what our prioritization is for outpatient appointments.
Thank you.
Okay, I went on the first San Bortolo tour with Dr. Novak, and I was there with a couple other women who are here. And he showed us all the floors that we'll go through, and there were no husbands. And so one of us asked, when are husbands allowed to be with you? And the head nurse responded, not until you're in active labor or pushing, which for a lot of women won't be for several hours. Which shocked a lot of us, and even Dr. Novak. And I was just wondering what the plan is with that or if that's going to change.
Thanks for asking that. Yeah, I actually talked to Chris Brown about that the other day. That was part of what's going on here is we have a very different expectation of care than the Italians provide in certain areas. I would tell you it is absolutely appropriate once you're in labor that the father or your husband, whomever that is, your significant other, is there with you. So if that was not the case on your tour, that is a concern that I have already taken down, and I will engage that with Dr. Zani. To ensure that that occurs. Now, in typical fashion in the U.S., if you were to come into an American hospital and say, hey, I think I'm in labor, just like we do over at the health center, we would do a quick examination, put you on the monitors and see where you're at. Active labor is defined as 4 centimeters dilated or rupture of membranes. And so if neither of those two things have occurred yet, you're not actually in active labor. So a lot of times what they'll tell you in the steps is, in the States is, go walk some steps for a while, go away for an hour, come back, we'll see how you're progressing, that kind of thing. I think what happens here in Italy is that you actually go into a little room and you just kind of hang out there for a while. So that's one area where just because of the quarters that are there, the father may not be able to be in that small area. Once you're in active labor, I would tell you it's absolutely appropriate to have your support there with you. And if that's not what the current practice is, I'll engage that with Dr. Zani to make sure that is our expectation for care. So we'll address that. Something else that's come up in the past is that there are no fathers allowed in C-sections here in Italy. I'm happy to say that our first dad will be in a C-section, I think this week, if not today, tomorrow. So we're testing that system out. And really, the reason for that, to make that point, is just the Italians at San Borla, they're very, very interested in trying to get us to where we feel we need to be. And actually what that does for the Italian medical system, it really kind of brings them almost to a more American standard. Some of that's good, some of that's not so good, but for them, especially in this arena, I think that's very, very good. So we'll definitely, I'll definitely bring that issue up and talk to Dr. Zani about that. Thank you. Sure.
Just to piggyback off of the last question, my husband was actually in the room with me from the moment that I got to San Bortolo when we had our baby. Not only was my husband with me, my mother was also. And this is not something that is typically done, but you just have to really let them know what it is that you need to make yourself feel comfortable. If there had been more women in labor, they have about 5 rooms that you go into until you're in your active labor, where they monitor your contractions. If every single room is full of women, then your husband obviously will not be allowed to be in there with you because there's nowhere for him to be. But if there is a room where you can be by yourself, they will allow him, and in this case also my mother, to come in and sit with you until you're ready to be moved into the delivery room. So it's mainly a concern about communication. You have to let them know what you need to be comfortable, because they want to help you and they want you to be at your best. And they're not going to do anything that's going to traumatize you. And I did not want him out pacing the halls. I wanted him in there with me. So really just let them know, and if they can accommodate you, they will.
Yeah. Well, when you go into San Bortolo, if you don't have it already, you should have the phone number for the patient liaison. And remind me to talk about the baby book here in just a minute. But as you come in, typically what happens is the staff will notify the patient liaisons, hey, we have an American in the emergency room, or we have an American up on OB-GYN, and the patient liaison will come and see you there. Now, obviously, if there's a time where we've got 4 patients in the hospital all at once, there may be some prioritization of care. My main concern is with our obstetrical patients and then our patients in the emergency room, and then it just depends on how severe some of those cases are. But with this big transition, I'm really trying to get us pushed towards taking care of the labor deck and making sure that everybody knows what's going on. We may not have an opportunity for a patient liaison to stay with you the entire labor, obviously, but they are there at the hospital 24/7, and they are on the phone. And so at any point in time, you or the father, anyone can call them to get them up there if we either don't understand what's going on or that kind of thing. As I tell you to advocate for yourselves, I will hedge a little bit and tell you just be very, very cautious. Birth plans are just like military plans. They don't survive first contact with the enemy sometimes. So, we can have this great birth plan, which again are expectations, but how that case goes might dictate that the provider, based on his comfort level and training, needs to take you in a different fashion. So really the key thing is understanding and communication, understanding what's going to be done, and being comfortable with that. And if they're about to do a bunch of stuff to you that you're not comfortable with, as long as everything is medically stable, I would ask you to take a time out and call the patient liaison to get that care there. Okay, hope I answered that question. The baby book. So I've briefed before that we're going to be putting out a what to expect when you're expecting in Vicenza book. That is probably about 75% done. We keep kind of kicking that a little bit to the right just because I want to make sure that I've got all the prenatal care clinic information in there so I don't have two versions of it out on the street and some people have information and some don't. So again, we will have that out in our prenatal care clinic for you, available. I'm hoping after about the 1st of May. We've only got a few more things to get done with it, but we will have that available for you. And for those of you that are due very, very soon here, it'll be a quick read, but we'll have that out for the community. We'll have that down at the patient liaisons at San Borlo and then up in the clinic and at the patient representative at the clinic. So that'll be coming. Other questions? Yes?
Is there a plan to increase the number of patient liaisons? Because already sometimes they have to prioritize if they're spread thin, emergencies come in at once, but with exporting the vast majority of, or all of the OB services, et cetera, there's definitely going to be a need for an increase in the number from a patient standpoint. Is there a plan for that?
That's something we're going to be assessing right now. So we have 9 patient liaisons. I am not aware of any other clinic in the European Regional Medical Command that has more than 4. So just at the face of that, now again, we're in a different situation here. I think we all realize and recognize that. But just to go back and ask for more from higher headquarters in fiscally constrained times, we have to have enough analysis behind that to make that point that it's actually required. Again, I talked a little bit earlier about negotiations that we're having with the TRICARE contractor to ensure that everybody's doing what they're supposed to be doing. But our patient liaisons do a lot of medical record transcription. They have a lot of other duties right now that I'm looking for other places to put that appropriately so that I can focus them more on the people business of taking care of folks in the hospital. So I think over the next couple of months, as we start getting patients down to San Borlo and we start testing this system, that's, the proof's going to be in the pudding there. We'll at least have some more data to make some good decisions on. I have no concerns about going to higher and asking for assistance if we need it. And I think Colonel Lee and Colonel Collins are supportive of that. We just need to kind of see what's actually on the ground right now for that. Okay. Any other questions? Hey.
I'm due on June 13th, and when I first got the phone call about the gray area, if I don't go by the 11th, I would be going down to San Bortolo, they told me that at some point our records, whoever was going to be in that area, would be transferred down to San Bortolo so that they would be on file in case for some reason I go into labor and it's 2 in the morning and the liaison's with someone who actually has a bigger medical problem that they have to stay with them for.
Sure.
So is that on us to make sure that we have our pregnancy passport filled out, or should we talk to our doctors about getting some sort of printout to have on file so that we can give to the doctor in case the liaison is not available?
Okay, I'll take that back and engage that. I don't have a specific plan for you right now on that, but definitely talk to your provider next visit, and I'll go back and talk to Colonel Burnett, who's our DCCS, and we'll make sure we've got that wrapped from both ends. But yeah, that would be, for those of our patients that will be transitioning that we've been providing care for, when Ann was in Germany, she had the little Mutterpass, the little passport, and I'll have to double check, see if we've got that already or how we're going to get those records with you so that the providers know what they're dealing with when you come in. But yeah, thanks for bringing that up. Thank you.